to get into this interview. So Leah and Tiffany, if you could just introduce yourselves and tell us a little bit about your practice.
Perfect. Well, I'm Tiffany Allen, nurse practitioner in family and women's health. And we have been so excited to start with this practice, and I'm excited that Leah has joined me. So if you want to introduce yourself.
Sure. So I'm Leah Hazelwood, and I do not have a medical background. So we're great partners. She handles the medical side and meets with our patients and assists them in their wellness. And I come from a marketing and business background. So we kind of work together, and it's a great harmony.
Yes, we mesh together well, since I am not marketing or business.
That was one of the first rules for my business coaches, that you find someone who can, if you have a weakness, that they have a strength. Yes. So that is so good in business. So tell us a little bit about what Triad Lifestyle Medicine is.
So Triad Lifestyle Medicine, basically our mission is to help people as naturally as we can. Now, that does not mean that we cannot prescribe medicines, right, because we can prescribe medications in situations where we need to. But we are trying to focus on getting to the root cause of an issue. So if someone comes in here with, I'm going to use anxiety, for example, we are going to look at that patient and look at different lifestyle factors that could be affecting that, such as nutrition, stress management, sleep, fitness would be another one, and then relationships, spiritual components. We're looking at all of those pieces to the puzzle to see if this is out of balance. That may be throwing everything off, correct? So that's one of the things that we're mainly looking at. And again, trying to be personalized. So not treating each patient with a protocol, trying to make sure that we're looking at, okay, this person has this factor, this family history, this, and this, versus putting everybody into the same umbrella.
Right. And how she's able to do that is because we've basically taken all of the red tape out of what is traditional healthcare. So she's not limited to a 5, 10, 15-minute appointment. She spends at least an hour with each patient. And she's the only provider. So there's only one patient at a time in the office. So that allows us to really personalize what the solution is. It might be sleep improvement. It might be sleep improvement and a nutritional plan. It may be some stress management. So whatever that person needs, it also includes connecting them with people like you, Monica. You know, yes, if they need services from another local health provider, we put that in their wellness plan, but we send them out so to a partner. And so it's all about empowering patients to realize that through lifestyle changes, they can improve or reverse chronic conditions without having to always resort to medication.
Exactly, and that's so important. And you highlighted the extra time that is taken for each patient to really listen to their concerns, to get down to the root of what's going on. What else would you say allows you to stand out from the traditional medical offices that people often visit?
One of the biggest things for me, and I would say and I would go to say Leah as well, our biggest passion is making sure, you mentioned empowered. So what that looks like typically, not always, but I'm going to say typically in a medical office is, again, it's that quick visit, so you don't have time to get into what does the patient really want, right? So one of the things that I tell people at the very first visit is that I'm going to give you my advice from a medical standpoint. However, if that patient looks at me and says, I don't want to do that, then we back up to try to figure out how we can meet them in the middle. Everybody is different. I have some people that says, I just genuinely cannot do what you're recommending. And we back up and we try to figure out how we can help that person. So again, I think that that's where we stand out because we have more time. We're able to work with them on a more personalized level, being able to help them from a different point of view.
I'd also add in that another thing that can make us different is because we've eliminated that red tape and we personalize our services, Tiffany has access to more specialized lab testing. So the pricing's transparent. Basically, she meets with a patient that needs a wellness plan and she says, well, I think, here's the pricing for all of the various labs we can do. I think this one, and this one would be great. What do you want to do? You know, do you want more? Do you want less? Would you rather not do any? It's all in the patient's hands, but that specialized lab testing can allow us to uncover the root cause. So I know as a patient of Tiffany's, you know, uncovering if a hormone imbalance is the root cause of sleeplessness, right?
Right.
Or malabsorption in the gut could be causing a vitamin deficiency, which is resulting in skin issues or anxiety. And so that specialized lab testing is very unique that we're able to offer that to people.
Mm-hmm. And are those lab tests something that a traditional doctor's office would perform, or these are more in depth?
They're more in depth than what a traditional office would typically perform.
Yeah, absolutely. So that's good to know, because some people might think, oh, I can go to my doctor's office and get these lab tests, but these are more in depth to be able to get down to the root of the problem.
That's
So why are your services, why would you consider your service to be so beneficial?
I think the main reason again is coming back to that empowerment, right? And educating patients and letting them know you have the power to change how you feel. And she is going to help you and guide you and support you and provide you accountability. But in the end, you hold power, and you don't have to just be at the whim of someone who says, hey, you feel this way, well, here's this medicine, you know, it may or may not work, it's going to have side effects, you know, I haven't really personalized it for you, but you know, this is different because it's, you know, uncovering what in your life is contributing to the chronic health condition and giving you the power to decide to make those changes.
And ultimately, the patient is the one making those changes. I mean, I am not the one that's going to sit there and prepare their meal. So when they are seeing how much better they feel on the plan that we give them, they're more likely to continue on that plan, but they're the ones that are doing it. So they get to be congratulated in the end. It's not a medication that's helping. It is what the changes that they're making. And so that, to me, you can't give that back. That's amazing to me.
And on the other side, aside from wellness benefits of lifestyle medicine, you know, another benefit to how we've structured our clinic is that there aren't crowds. As we said earlier, there's only one patient in at a time. So there's not crowds, there's no long waits. You're getting more personalized attention. So, I mean, we have free refreshments. We've created what we think is like a kind of like a cozy, like you're going into your friend's living room to sit down and have a conversation. Our assessment room and our conversation room in the back is where she spends most of her time. She has an assessment room with an exam table, but that's not where she spends time with patients. It's on the couch so that she can have a conversation. And so getting rid of that uptight dread that
the stigma that's associated sometimes, right?
Yeah.
We want people to feel comfortable. We want them to feel like they're able to open up and to show us a bit of their life so we can help them.
Absolutely. And I'm glad you brought that up, because that was my next point, is pointing out how your atmosphere is already different once you walk through the door. It's very welcoming. It's very comforting. It does ease the tension that people have sometimes when they are going to see the doctor. And just like you mentioned, I've toured your office, and it is the conversation room is just so cozy. So I just want to just thank you for just wanting to provide that type of service. And Tiffany, tell us a little bit about why you decided to start this practice. What was the inspiration?
Well, there's several factors that go into it, but I think the main inspiration for me is that as a medical provider, as a nurse practitioner, I always want what's best for my patients. I always want them to feel like that they're heard. I always want them to know that I care about them. And so when you are in a traditional practice, you're limited on the amount of time that you can spend with them. It's not how we want it to be, and it's not that those places are bad. It's just that is the traditional medical model. And I just kept seeing that there's so many ways that I can help people outside of this 10 minutes. And there, you know, we can try this, we can try that. And I just want people to know again how much that I care about them, and especially as making sure that they feel better. And for me personally, I had a chronic medical condition that I had seen multiple providers about, had been on numerous different treatments to try to fix it, and I was not feeling better. I mean, it just continued to get worse and worse and worse, to the point that it truly was starting to affect even my mental well-being. And so finally, I started doing my own research and trying to get to the bottom of it. And I was able to. I was able to uncover some of those deficiencies that were causing my issues. And I feel so much better all around. And that was something that, again, it's not that the traditional medical model didn't want to help me, but it's back to they're limited. The sources are limited as what they can use. But as far as the real piece of the puzzle, I mean, that was a big one. But the real piece is that I saw over and over and over people that were just not getting better. And I feel like it was resources. I feel like it's accountability. And those are things that Leah and I wanted to make sure that we could offer to people. Because we, again, want people to feel empowered. We get one body, we get one opportunity to take care of it. And I want to help people to do that. I want to help people to feel better, or if they already feel good, to stay feeling good, right?
Right.
I think that's the biggest reason.
Awesome. Awesome. Well, is there anything else you would like to share with everyone?
I just like to mention that when Tiffany and I started this company back in the beginning of 2020, one of our prerogatives was to find ways to give back to the community as well. And we don't want the knowledge of how lifestyle medicine can truly improve people's wellness to be limited to only the patients who can get here. There are lots of people who don't have access to medical facilities like this, where a doctor can spend an hour, or a medical professional can spend an hour with them and help them. And so if anyone out there has a group that would benefit from a seminar led by Tiffany, where, you know, we can talk about lifestyle medicine. And when I say talk about lifestyle medicine, it's talking about the ways that nutrition can affect your health, the ways that sleep can affect your health, or movement, balance, you know, all of these things that affect how we feel. You know, that's information that everyone has a right to have access to. And so I just want it to be clear that we are open and willing to lead seminars, whether they be virtual or in person, you know, at no cost, just to kind of share the knowledge and our passion for empowering people.
That is awesome. That is so awesome. So tell people where you're located, and then also what social media platforms that they can find you on.
Sure. So we are in the Deep River Business Center, which is right on the corner of Willard Dairy and 68 in High Point. And it's basically right where High Point gets ready to turn into Greensboro. So there's Capra's Deli is right in our complex, and it's right on the corner. A lot of folks know where that is. But as far as finding us online, you know, we have our website, triadlifestylemedicine.com, and we're very active in social media like Facebook and Instagram. Again, if you just type in Triad Lifestyle Medicine, you can find us. We're accessible. You know, you can contact us through those social media platforms. You can contact us through our website. We have a really quick and easy contact form, and of course we have a phone number if that's what you prefer.
Okay, awesome. Well, if anyone has any questions, feel free to post it in the comment section, and I'm checking them now. Okay, so we'll give it maybe just about a minute and see if anyone has any questions. But right now, I just really want to say thank you for taking the time to join us. And I am just a big fan of Triad Lifestyle Medicine. So however I can get the word out to let people know about your wonderful facility, then I will definitely do that. And if questions come in later, you know, I know you guys will be tagged on the post, and so you'll be able to answer them as well. So thank everyone for joining, and I still don't see any questions, but I hope you guys have a great rest of the evening, and thank you, Tiffany and Leah, and I'll talk with you soon.
Thank you,
Thanks, Monica.
Bye.